Thank you for the invitation. Stent with Torsional Strength for Superficial Femoral Artery. It's my pleasure to present the data of the Q3 registry. So, here's my disclosure. We are all familiar with the problems we have to face with the SFA: longitudinal compression, calcification, banding, and the SFA stent of the Polaris stent of the Qualimid company is a stent with high torsional strength, and it is designed to resist bidirectional torsion. So we have to check whether this is correct or not. In this laboratory testing, our stent, the Polaris stent, is compared to 3 competitors. And they are turned to the right and to the left. Here you can see turning 90 degrees in both directions. Nothing could be seen, no impact to the stent integrities. Here 180 degrees left and right, and you can see that the competitors had some problems. They are turned in there, and their integrity is not completely unchanged. And then when we turn it completely, turn right and left, you can see that the competitors don't work anymore. So we have included almost 200 patients. Mean age was 70 years, 70% were male patients, 38% patients with diabetes mellitus, 11.7% critical ischemia, and the mean ABI was 0.6. Here we have the lesion characteristics. The mean lesion length was 10 centimeters. 24% of the lesions were longer than 15 centimeters. Total occlusions 44%, and in 27% we had lesions with severe calcification. Technical success defined as completion of the procedure with less than 30% residual diameter stenosis was 99%, and procedural success defined as technical success without major adverse events before discharge was 96%. You can see our peri-procedural complications in our 200 patients. Dissections occurred in 28%, flow-limiting dissections with the need of an additional stent implantation in 13%, 2% distal embolization, 1.4% false aneurysm, and 1.1% major adverse events, 1 gastric bleeding, and 1 myocardial infarction. Primary endpoint was freedom from clinical-driven TLR at 12 months. It was 94% after 12 months and 88.7% after 24 months. 2 factors influences the freedom rate of TLA. Long lesions, you can see that for the longer lesions, the freedom from TLR was 74% versus 100 in the shorter lesions. And ABI. ABI is a sign for distal runoff. And if we had an ABI more than 0.7, we compared more than 0.7 versus less than 0.7. And you can see again significantly better results for the patients with a better runoff, with a better ABI. Clinical improvement with regard to Rutherford category and walking distance. For both, we highly significant improvement for each follow-up versus baseline. As you can see, my internet connection is unstable. Oh. Coming to the safety endpoint, freedom from major cardiovascular and limb events. It was 95% after 12 months and 94% after 24 months. So in conclusion, we can say that a modern stent-based treatment is still appropriate for de novo SFA occlusive disease. The Polaris stent is efficacious for the treatment of SFA lesions over the medium term. That's what we can say, medium term. This also applies for complex lesions, conclusions, and severe calcification. And there were no safety concerns. And we are very happy that yesterday our study was accepted for publication at the Journal of Endovascular Therapy. Thank you for your attention.